Tom, Allie, and I have been studying lung cancer in Appalachian, Kentucky, and doing an analysis on why this region seems to have such a high incidence of lung cancer compared to other areas in the United States and the world. So lung cancer is the leading cause of mortality among all cancers. It's heavily related to smoking and radon exposure. Kentucky has the highest incidence of lung cancer rates in the United States, and the Appalachian region in particular, which is in eastern Kentucky, is known for its rurality, poverty, and historical context of significant coal mining. There's also been identified the youth deficit in Appalachian Kentucky, where the median age is higher than other areas of the country.
Continuing with that, historically there has been a over-reliance upon coal mining as a part of the economy, which has led to many individuals within the region going to work in the mines, and the sharp subsequent decrease of employment in the mines has led to poverty, both of which being in the mine and low SES are correlated to lung cancer. Lack of non-negative attitudes towards smoking and or policies towards smoking cessation also play into the region's issue with lung cancer. As mentioned before, there's a youth deficit, which means the age distribution in the region is heavily towards the age where getting lung cancer is of a higher likelihood. And also, there is an inaccessibility to healthcare problem. And even when there is the access to the preventative healthcare that's needed, with it being so rural, the infrastructure is very sparse and very distant.
So we've identified some environmental determinants of lung cancer in Kentucky. So the coal mining practices, as mentioned, Appalachian Kentucky heavily relies on mountaintop coal mining, which produces more coal fly ash that contains radioactive particles that can spread into the area. The soil composition of the Appalachian region itself has also been notified to have higher composition of shale and other radioactive materials. And the region is highly reliant on well water, which can be contaminated with the byproducts of coal mining practices and parts of the soil, which can contain aluminum, chromium, cobalt, and radon, which are known carcinogens. Some behavioral and psychosocial determinants that we found. So smoking tobacco is obviously heavily related to lung cancer, and Appalachian Kentucky residents have a higher rate of smoking tobacco and being exposed to secondhand smoke than other citizens of the United States. They also have been noted to have suboptimal nutrition. They have higher access to fast food and history of home cooking that can be somewhat unhealthy, and less access to supermarkets, farmers markets, and other fresh and healthy options. They've also been noted to have reduced physical activity. There aren't many available safe walking trails or gyms because of the rural location of a lot of these residents, and all of these together can contribute to a risk of lung cancer development.
We've also seen a reluctance towards preventative healthcare, and we believe that most of the reason behind this is a lack of education surrounding available resources and affordable resources that are federally funded or even available through private insurance. There's also a negative attitude towards past intervention and campaign methods regarding smoking cessation that has just left residents of Appalachian Kentucky feeling more discouraged and less hopeful than motivated to be proactive about smoking cessation and healthcare overall. There are also several biological and genetic determinants that we've found in our literature reviews. CHRNA3, A5, and B4 are all genes that have been associated with nicotine dependence, which has the ability to predispose somebody to greater smoking of tobacco products, which is known to increase risk greatly for lung cancer. DNMT1 is an epigenetic factor that has been found in nitrosamine in tobacco, which has contributed to higher rates of lung cancer as well. KRAS and EGFR are both tumor suppressor genes that have been mutated to be associated with a greater risk of lung cancer and have been found in over 40% of lung cancer cases.
with regards to structural bias, we have seen a structure in which the incidence of lung cancer is higher in men, not in just in Appalachian Kentucky, but all of Kentucky. We believe this heavily was due to the fuller participation in mining in men up until recently, where the fuller participation started to be balanced starting in 1973 when women were officially allowed to work inside of the mines. Also, we see that there is a lack of education and preventive healthcare accessibility problem in general, but specifically it affects, on average, the Black Kentucky community more. And then we also saw that there was an impact by globalization. Both of the world wars to help drive the war effort, coal was used at home for production and overseas. In the Federal Mineral Leasing Act, shortly after World War I, states were incentivized to create new mines to mine for minerals and coal, in which Kentucky, so more people within this population were going to the mines, being exposed to the carcinogens and diesel. And then after World War II, there was the Marshall Plan, in which the US and other countries were dedicated to economically boosting the world to recover from the war. And as part of that, many states in the US had an increased mining employment, which meant even more people from Kentucky going to the mines.
Our social ecologic framework has shown various systems and exposures that have increased risk of lung cancer among men in Appalachian Kentucky. The biggest takeaway we've discovered is the smoking culture that has almost developed within Kentucky that is perpetuated by state smoking legislation, such as low cigarette tax and limited restrictions on smoking age. This smoking culture has resulted in a lack of proactivity against smoking cessation, which in turn results in less participation from Appalachian Kentucky residents towards interventions that have been placed for them in efforts to reduce lung cancer in this region. A lot of reasons for this may be lack of community outreach and education that is building hope and encouraging the community to be more proactive about screenings, and lack of education about available healthcare and screening options for them, which is what we wanted to focus our priority intervention on. A lot of residents aren't aware of the survivability of lung cancer if it's caught in the early stages. Most lung cancers are caught in stage 3 or stage 4, where survival is roughly below 10%, whereas if it's caught in stage 1 or 2, it can be upwards of 80% survivability. So being able to educate the residents, the community, on the survivability of lung cancer if caught in the early stages could really change the attitude towards lung cancer screening, as long as we are also educating this population about the resources available to them. Often people aren't aware of these resources. They don't understand that there's federal funding for it. They don't think it's affordable. And then all that they are really being exposed to is smoking intervention methods and really graphic imagery that they've stated to be discouraging towards their efforts in preventing lung cancer. So if we're able to produce these encouraging testimonies from individuals who have done the appropriate methods of screening and taking the initiative to prevent lung cancer and take care of their health, and they've caught cancer in the early stages and survived it, then we'd likely see a greater motivation towards lung cancer screening, as well as smoking cessation as a result of lung cancer screening results, which we've found in some of the studies that we've reviewed.
So some strengths and limitations that we found. We were able to find a variety of sources, including historical records and census data, to support our findings for lung cancer in Kentucky. Many factors were identified as contributors to lung cancer, which gave us some strength in our findings, but also made it a little bit difficult to pinpoint a good intervention. There's also a lack of consensus on the exact cause of lung cancer, which made it a little bit difficult to find what's causing such a high rate in this area. The rurality of the area also limits data collection because it makes residents hard to get to. They may not have internet access, etc. And the data was also collected prior to the COVID-19 pandemic, so we would be interested to see how rates have changed since the start. Finally, we'd like to conclude that Lung cancer does have the highest mortality of all cancers, but it is largely preventable. Low socioeconomic status and low health literacy can confound the causes of lung cancer. Federally funded intervention strategies that help with detection at early stages increase survivability and also help save lives and save costs through this early detection. So we would like Kentucky residents to become more aware of their options for early detection and treatment.